Are you about to turn 65 and starting to have questions about Medicare? Or maybe you're past the age of 65 and you're still working and you have health insurance coverage through an employer for you and perhaps for your spouse. Or perhaps you are under the age of 65 and you've been on Social Security disability for a while and you're about to be eligible for Medicare. My name is Jim Johnson, and I've been a volunteer benefits counselor with the Area Agency on Aging for quite some time. And trying to figure out Medicare is not easy. It raises a lot of questions. And we sometimes refer to this as a Medicare puzzle. So what we're going to try to do today is answer some questions like, what is Medicare? When and how do I enroll? What does it cost? What are Parts A and B? What is a Medicare Advantage plan? What is a Medicare supplement? How do I pick a Part D plan? How can I get help to pay for my prescriptions? And what if I can't afford my Part B premium? We're not going to answer all of the questions because there are some things that change from time to time. Some things will change by the time you look at this video probably. But if, in fact, you have questions, we'll tell you how to get answers from other people as well. Benefits counseling is part of a program offered by the Area Agency on Aging, which is part of the Alamo Area Council of Governments that we call ACOG. This program, as well as other programs offered by the agency, as well as other things that are offered by ACOG, are provided to a service area that includes Bexar County and the 12 surrounding counties, as you see. If you have questions after you watch this video, or after you watch part of it, or when it's over, you can call the Alamo Service Connection, which is sort of an input area for the Area Agency on Aging. And they can provide you with answers about services. They can help you make appointments, or get a benefits counselor to call you back so that you can talk on the phone, or perhaps even have an in-person meeting if it's necessary. Well, there are 4 parts to Medicare: Parts A and B and C and D. Parts A and B are what we refer to as original Medicare because they've been about since 1965. They've been around since it was signed into law by President Johnson. Parts C and D, and I like to refer to them sometimes as A, B, and D, and then C, and you'll see why as we go forward. But Part D, which is prescription drug coverage, has been around since 2006. And Part C, which are Medicare Advantage plans like HMOs, PPOs, those have been around since the late 80s. They've had different names, but they've been around that long. And we'll go through each one of these as we go forward and talk about what they cover. But what is Medicare, and who is eligible for Medicare? It's a federal health insurance program. It's a program for individuals. It's not a group plan like any HMO or PPO you may have had through an employer. It's different for everybody. It may be even with a husband and spouse, or a wife and spouse, that you may have 2 different needs, and you may need a little different angle on what you do with the Medicare plans that are available to you. Who is eligible for Medicare? If you're 65 years or older and you're a United States citizen, you're eligible for Medicare. It has nothing to do with whether you have any work history or not, and we'll talk about that as we go forward too. Also, if you're a permanent resident of the United States and you've been here for 5 years, you are eligible for Medicare. And if you're under age 65 with certain disabilities, you are eligible. Also, end-stage renal disease, if somebody has that, or somebody has ALS, known as Lou Gehrig's disease, you can be eligible for Medicare almost immediately. I've even known of situations, or there are situations where babies that are a month old or 2 months old with end-stage renal disease can qualify for Medicare through their parents. Well, how do you enroll in Medicare? You enroll through Social Security. We have a Social Security Administration. We also have CMS, which is a Center for Medicare and Medicaid Services. They're different in a sense, but they tie together, and you enroll through Social Security. You can do it online by going to ssa.gov. You can go to Medicare.gov as well, but it's going to link you back to Social Security. Or if you don't want to do it online or for some reason you can't, you can visit your local Social Security office. In order to do that, I would suggest that you call the national number 800-772-1213 to make an appointment with a local office. If you're retired from the railroad, you do so through the Railroad Retirement Board, and that number is listed, 877-772-5772. I have also listed the TTY numbers for convenience. Well, there are 3 different enrollment periods, distinct enrollment periods for Medicare. We have an initial enrollment period, we have a general enrollment period, and then we have a special enrollment period. You can first sign up for Medicare Parts A and B during the 7-month period that begins 3 months before the month you turn 65, includes the month that you turn 65, and ends 3 months after the month you turn 65. So in our example, you'll see here we've got someone, let's say their birthday is on July 15th. They can start enrollment in April, they can do it in May, and they can do it in June, and their Medicare will start on July 1st when they are eligible to have it start. If they miss that, they can enroll in August or September and October, and it will normally begin 1 month after they do that. Now, one of the reasons I put July 2nd to July 31st, as you see, because there is a different situation. There's always an exception, right? If your birthday is on the first day of the month, like in this situation, if this person's birthday were July 1st, everything goes back a month. Your 7-month period is going to start in March, and it's going to end in September. So that's a little bit confusing, but that's the way it works. And then your Medicare, if you were born on July 1st, if you get it done like you're supposed to, it will start on June the 1st, the month before your birthday. Now, if you are drawing Social Security benefits before you turn 65, then you will automatically be enrolled. So if you start benefits at 62 or 63 or 64, you will receive a Medicare card in the mail before you turn 65. It will have Parts A and B on it. You decide if you want them both, or want either one, or just want one or the other. And then you can go from there. Otherwise, you must enroll in Medicare. I point this out because oftentimes there are people who will have a next-door neighbor that tells them, oh, don't worry about it, you're going to get your Medicare card in the mail. Well, if you started benefits early, yes, but if you're turning 65, no, you won't. You have to contact Social Security in order to enroll. Also, we point out that if you are disabled and under the age of 65, your Medicare will automatically begin after 24 months. It will start on the first day of the 25th month following the start of your Social Security disability. Then when you turn 65, you kind of start all over and you can enroll again and do things that you can't necessarily do with Medicare when you're under the age of 65. You have more choices. There is also a general enrollment period. In other words, if you fail to sign up for Parts A, or particularly Part B, during the initial enrollment period that we showed, and you don't qualify for a special enrollment period, which we'll look at on the next slide, then you can sign up between January 1st and March 31st of each year. So if you miss, like case with the July 15th person, if they miss that 7-month period that ended in October, then they can sign up between January 1st and March 31st of the following year, and their Medicare, as of now, 2023, will begin the very next month. Up until this year, if you had to sign up during the general enrollment period of between January 1st and March 31st, it would not start until July 1st. But they've changed that as of 2023. You sign up in the first 3 months, it will begin the next month. If you fail to sign up when you need to, you may end up having a higher premium for late enrollment. In fact, with Part B, if you don't sign up when you're eligible to do it, for every 12 months that goes by that you aren't in it and you should be in it, you'll have a 10% penalty. So if somebody waited 26, 27 months, they've got 2 full 12-month periods, they're going to have a 20% penalty on their Part B premium, and they're going to pay that for the rest of their life. It does not go away. Now, I point out at the bottom that if you qualify for premium-free Part A, meaning you've worked for 10 years and paid the Medicare tax of 1.45% for 10 years, in order to receive 40 credits, then you can sign up anytime you want after eligibility begins and without penalty because you paid for it. So you're entitled to premium free. And so if you don't want it when you turn 65 for whatever reason, you want to wait till you're 70 or 72, well, you can do that. You're not going to have a penalty. There's also a special enrollment period. If you or your spouse are still working and you're covered by a group health plan, you can sign up for Medicare Parts A and B while you're still covered by that group plan, or you can delay and sign up during the 8-month period that begins a month after the employment ends or the coverage ends, whichever happens first. Usually there is no penalty if you sign up during this period. So we'll repeat that and think about it. If you continue to work and you have employer insurance, not retirement insurance, but you or your spouse have insurance through an employer, through your employer, or the spouse through your employer, then you do not have to sign up for Part B while you have that insurance. You can wait up to 8 months after your employer insurance ends, and then you can sign up for Part B. Now we point out here at the bottom that if in fact you qualify for premium-free Part A, you can sign up anytime after eligibility without penalty. But it's probably to your advantage to sign up for Part A while you're still working. If you're working and you have health insurance through an employer, or your spouse has your insurance, they turn 65, there's no reason to sign up for B, but you should go ahead and sign up for A whenever you're eligible because it doesn't cost you anything. Most employer plans are going to have, let's say, a deductible like $500 or $1,000 when you go to the hospital. If you have Part A, it will pick up that deductible for you in all instances, almost. So it's wise to have it because it doesn't cost you anything. One thing about Part A as well, which some people don't realize, it's not advertised a lot, but really, if it's premium free, whenever you sign up for it, it can actually be retroactive for 6 months. So if you've actually incurred hospital bills and you didn't have it, but all of a sudden you become eligible for it at 65, you can sign up for it later on. Now, if you're 65, you can't go back 6 months. But if you're 65 and a half, you could go back 6 months, all the way back to when you were first eligible. We point out that it may be wise to delay Part B if you or your spouse are still working and covered under employer insurance. The reason being is because we're going to talk about Medicaps, Medicare Supplement Plans, and in most states, including Texas, you have what's called a 6-month guaranteed insurance time, or once you have Part B, you can get any Medicare supplement plan you want from any insurer. They cannot charge you any more than they would anybody else your age living in your area. And the reason that is important because if you have health conditions and you wait past the 6 months after you have Part B, they can do medical underwriting. They can deny you. So you don't want to sign up for Part B. Normally, if you have health insurance still through an employer past the age of 65, you want to delay it because if you sign up for it, by the time you stop working and need to go on Medicare full force, you can't get a Medicare supplement plan. So it's important to think about that part. What about a spouse? If you have 40 credits, your spouse can usually qualify for premium-free Medicare Part A at age 65. So even if you haven't worked or you work less than 10 years, you have less than 10 years worth of credits or 40 credits, you can sign up for Medicare A at age 65. If you're divorced, you can also receive benefits based on your ex-spouse's record if your marriage lasted 10 years or longer and you are unmarried. If you're married again, not on the ex-spouse. But one of the things that's to avoid there is that people that get up to a certain age maybe don't get married for 1 year and decide, now let's get divorced, but I'll get my Medicare. You're going to be married 10 years. Marriage had to last 10 years. What about premiums? Part A and Part B. Again, Medicare Part A is premium free if you or your spouse have earned 40 credits for 10 years. They used to be called quarters. Now they're called credits because you don't have to earn them in each quarter. You can earn them all at one time in a given year. If, in fact, you do not qualify for the premium free, then when you buy Part A, you'll have to pay a premium that goes up every month. And it's $278 a month if you have between 30 and 39 credits. If you have less than 30 credits, it's $506 a month that you would have to pay. Part B, I need to emphasize this. Every beneficiary pays a Part B premium or has it paid for them, maybe by the state if they're on a Medicare savings program or through Medicaid. Your earned credits have no bearing on eligibility or the amount you pay. The standard premium, what they call standard premium in 2023, is $164.90. I point that out because it is amazing. There are people, a lot of times, who have worked all of their life and they're about to turn 65 and maybe they've lost their health insurance or they don't like it, and you'll hear them say, I'm about to turn 65. Boy, I can't wait. I'm going to get my Medicare and it's not going to cost me anything. Not true. Everybody pays for Part B or somebody pays for it. The only thing your work history does for you, all those years you pay a Medicare tax, is it gets you premium-free Part A, but everybody is going to pay Part B. Also, if you are receiving Social Security benefits, that premium is going to be withheld from your benefits if it's sufficient to cover. You have no choice. If you are drawing Social Security, they're going to take the Medicare Part B premium out of your Social Security benefits. If your Social Security benefits aren't large enough to cover it all, they'll take everything you got in Social Security and then they'll bill you for the separate part. Now, a lot of people defer their Social Security now all the way up to age 70. Still, you're eligible for Medicare at 65, and if you join at 65 or sometime before Social Security starts, well, yeah, then you can pay it either quarterly, or pay it to Medicare, or you can have it taken out, set it up to take it out of a checking account. If you're a retired federal employee, you can set it up to have it taken out of your annuity or your pension with the federal government, but it's going to be taken out of Social Security whenever you start. Now, there is something that's called a hold harmless provision, which some people don't worry about, or don't know about, pardon me. But if, in fact, let's say this next year, that standard premium goes from $164.90 to $174.90, which is approximately what they're estimating it will do, about $10. If your Social Security benefits is where your Medicare premium is taken out of, they cannot normally raise that premium on you any more than what your increase is, your cost of living adjustment. So Social Security cost of living adjustments are supposed to be announced day after tomorrow. And let's say they announce them at a low rate, and let's say somebody who's on Medicare gets a $5 increase in their Social Security benefit. If that Medicare premium is taken out of their Social Security, they won't be able to raise theirs $10. They can only raise it $5. And they'll try to catch up later on. There's always exceptions. And where the exception comes in, if you're not having it taken out of Social Security because you don't get Social Security, or you're having it taken out of a checking account, or you're having it taken out of federal employee retirement, they're going to raise it full force. Also, if you are subject to IRMA, which we'll talk about, which is an income-related adjustment amount on your premium, even if it's taken out of your Social Security, yours is going to go up the full amount. So it's only for the people that have to pay no more than the standard premium and have it taken out of their Social Security that are subject to this hold harmless provision. Well, speaking of IRMA, which is an income-related monthly adjustment amount, this came about during George W. Bush's administration. But if you have a higher income, you're going to pay more than that standard premium of $164.90 this year. This affects only about 7% of Medicare beneficiaries. When it first went into play, it affected 2 or 3%, but it seems like incomes are rising quicker than what the adjustment to that IRMA is. But in 2023, beneficiaries who file an individual tax return showing their modified adjustment income over $97,000 for an individual, and if you're married, a joint return over $194,000 will pay Part B premiums that range from $230.80 to $560. $230.80 is 140% of the basis. The $560 is 340%. So it's based on income. 97 and 194 projections are next year that probably will go respectively to 103 and 206. People that pay the $560 are people who have income over $500,000 or married couples over $750,000. You don't see a whole lot of those, but there are those out there, of course. Well, let's look at the individual parts of Medicare. First, hospital insurance, part of original Medicare. What does it cover? Well, Part A covers inpatient hospital stays. It does not cover emergency rooms. It covers inpatient hospital stays when the doctor has decided that you need to be admitted. It actually is set up to pay for semi-private rooms. Now, you may have known people on Medicare that get private rooms if they're available. A lot of times they will, but it's up there to pay basically for semi-private rooms. Part A also covers skilled nursing facility, not custodial care, and it's not long-term care insurance, not nursing home insurance. We need to emphasize that. It will cover skilled nursing facility when the doctor decides that after you've been in a hospital as an admitted patient for at least 3 days, you may decide you need physical therapy, you may need occupational therapy, some kind of therapy. Medicare Part A will cover part of that nursing home facility cost. It also will cover some home health services that a doctor determines are medically necessary, and it will also cover hospice care. Well, Part A has a coinsurance. If you have original Medicare, or you have A and B, you don't have a Medicare Advantage plan that we're going to talk about later, which have their own separate deductibles. But if you have original Medicare, there is a deductible under Part A when you are admitted to the hospital. And in 2023, that deductible is $1,600. That if you're admitted, you're responsible for that right off the bat. And that will cover you for 60 days in what they call a benefit period. There's no coinsurance. You're covered for 60 days once you pay that. Now, we'll talk later about Medicare supplements or Medigap plans that people can purchase to cover these deductibles and copays. But Medicare Part A itself, through Medicare, you do have a $1,600 deductible. If you are in more than 61 days in a benefit period, then you have another $400 coinsurance period per day that you have to pay. Most people aren't going to be in more than 60 days in the hospital, or otherwise you have big problems. Probably something else is going to happen. You may not be there. You're going to go to a nursing facility or something. But a benefit period, for what it's worth, and we don't need to get into all those other definitions because it's not going to happen very often. If it does, then you'll be asking questions when you encounter it. But a benefit period is also a 60-day time period. So if you were to go in the hospital on January the 15th, and you'd be there till February 15th, and you go home, but you come back again before March 15th, you're still in the same benefit period. You would not have that $1,600 deductible again. However, if you go in January 15th, you come out February 15th, and you go back in July, it's going to start all over again. You got that $1,600 period one more time. Down at the bottom, skilled nursing facility. Under Medicare A, you pay nothing for the first 20 days. After that, you're responsible for $200 daily for days 21 through 100. And again, there are Medicare supplements that you can purchase to cover that. Well, Medicare Part B, the medical insurance. What does this cover? We normally think of it as doctor visits, but there's more to it. It covers outpatient care. It will cover doctor visits, and that's the thing that's used for most of all. But we talked about Part A being for inpatient hospital. It's Part B that will cover for the hospital emergency room. Part B will also cover certain home health services. It will cover durable medical equipment, such as wheelchairs, walkers, things like that, certain diabetic supplies. It will cover laboratory tests and x-rays and preventive services, rehab services, including physical therapy and occupational therapy, not for the facility, because we saw that under Part A, but it will pay for the services provided by the doctor or the nurse or whoever's doing it. Also will cover palliative care, and it will cover other medical services. So it's pretty wide-ranging. It will cover quite a few things. There's also a deductible on Part B. And in 2023, that deductible is $226. This is an annual deductible. It normally goes up every year. This was an anomaly this year that it actually went down. But normally it's going to go up every year. I'm sure it will go up next year. But that means that you're responsible for the first $226 with most Part B services, particularly going to the doctor. You're responsible for that out of your pocket unless you have a Medicare supplement to cover it. After that, Medicare will pay 80%, and you're responsible for the other 20%. So if you go to the doctor the first time and you have a $200 doctor visit, you're responsible for that, or you have a Medigap to pick it up. Once you get past that, and you pay another $26 out of your pocket. After that, Medicare is going to pay 80% of all of your doctor bills. You're responsible for 20%, either out of your pocket or through a Medicare supplement. Now, there are certain preventive services where there is no copay and no deductible applied. Particularly, those are certain kinds of tests, like different kinds of tests for different problems you may have, diabetes screenings, PSA for men, women's examinations, alcoholic checks, things like that. There's no copay. Also, Part B will pay for flu shots and some other vaccines. There's no copay for that. You can go to the pharmacy and get it, and Part B will pay for it. So that's Medicare coverage. Now, in order to cover these gaps that we're talking about that you might have with a Medicare supplement or with Part A, to cover the gaps with Medicare Part B or with Part A, you can get what's called a Medicare supplement, or it's called a Medigap. This is when you have original Medicare, when you have A and B, and most likely have D that we'll talk about at prescription drug coverage. These plans are sold by private companies authorized by the Center for Medicare Services. CMS has to approve it, and the state insurance department has to approve the company. So you've got companies like Cigna and United Health and Aetna and so forth and so on. Same ones that will also provide Medicare Advantage plans. They also provide Part D plans, but they provide these supplements. They're still sort of governed by Medicare, but they are private insurance companies. You have a right, like we said earlier, a guaranteed issued right. When you have Part B, you have a right, once you get Part B, to purchase one of these with no questions asked, regardless of your health. You can have diabetes, you can have a heart attack, you can have cancer, or anything else. During the first 6 months after you get Part B, you can get one of these plans, and you do not have to go through any kind of questioning. You'll pay the same thing as a healthiest 65-year-old will pay. Once you get past 65, once you get past 65 and with Part B, or whenever you get it, if you get it at 70, you still got 6 months to get one of these plans. But once 6 months has passed after you get Medicare Part B, and then they can ask you medical questions, they can deny you, they can charge you more based on your health situation. So at the bottom, once again, I point out with the asterisk, it's wise to delay Part B if you or your spouse are still working and covered by employer health insurance. Important to remember. What do these Medigap plans look like? Well, they're actually lettered, and this is confusing sometimes because we have Medicare, parts A, B, C, and D, and we have Medicare supplement, Medigap plans, A, B, C, D, and so forth. But these are what the plans are. They're really the same in every state. Every company that sells them, they cover the same thing. They have to. You do have differences in Wisconsin and Massachusetts or something, but the other 48 states all follow the same guideline. And you will see what they cover. In other words, you will see that every one of those plans, if you buy it, is going to cover the Medicare Part A coinsurance and hospital costs. That's a $1,600 copay that you would have if you went into the hospital. And what you have, $400 if you're in more than 60 days and so forth and so on. It will cover that. You go down to the bottom, closer, you'll see the Part A deductible. There, not everybody covers it, but you do have B, C, so forth and so on that will pay 100% of that deductible. That's the $1,600, or that's the that we were talking about. You will notice that I have blotches or explosions on Medicare Part C and Part F, and on the Part B deductible. Because C and F are plans that were considered to be sort of the best. They covered the Part B deductible, that $226 we were talking about. Well, a couple of years ago, Medicare decided that they weren't going to allow any plans to cover that Part B deductible, which is $226 this year and probably go up next year. Why? Because they felt that people were abusing it. Pardon my exaggeration, but probably the thought was, since Part C and Part F cover everything, that people with hangnails might be running to the emergency room. That is an exaggeration. But they've realized that people were going and costing Medicare too much money. So they changed it so that now, you see down at the bottom, Plan C and F are available only to people who were eligible for Medicare before January 1st, 2020. But what you have, if you look at Plan G, that's now the Cadillac. F was before. But Plan G covers everything that Plan F covered except for that Part B deductible. And you're normally going to find with any given company that sells G and still sells F, even if you're were born before or were eligible before 2020, you're going to find that the premium on Plan G probably saves you more than that $226 deductible in a full year. It will save you more. Plan N also sort of covers everything that G does. I did fail to put one little thing on the bottom here, that is the difference between G and N has a lower premium, is that N covers everything, but you will have a deductible, maybe $15 or $20 when you go to the doctor. With Plan G, you have no deductible or no copay once you go to the doctor, once you met the $226 deductible. So these are Medigap plans. Every company sells them. No matter who sells them, they have to provide the same thing. They sell you a Plan G, no matter what company it is, they're going to cover the same thing. Well, there are occasions where you may not need a Medicare supplement. For example, if you're retired from the military and you have TRICARE for life, you've had TRICARE up until age 65. You're 65, you have to go on Medicare. You have to sign up for Parts A and Part B, but TRICARE for life will serve as your supplement. It will pay what Medicare doesn't pay, and it will also provide you with drug insurance, prescription drug insurance. If you have TRS, Teachers Retirement System in Texas, you may not need to have a Medigap. In fact, you won't. If you're a retiree from the federal government, you have FEHB coverage, you may not need Medicare's Part A and or B, but there could be advantages to obtaining both, because it may supplement what you have with the federal government. If you have other forms of former retirement health insurance that will cover Medicare deductibles and copays, that's fine. But like we pointed out, we emphasize the fact that you need to sign up for Part B normally after your health insurance through an employer stops, because most employers do not provide you with continuing insurance after you retire unless it's simply some kind of supplemental insurance. But you can do that through some companies. And once again, I point out at the bottom, regardless of the retiree health coverage, everyone should enroll in Medicare Part A if it's premium free. Well, Part D, prescription drug coverage. If you have original Medicare, and about 50% of the beneficiaries, Medicare beneficiaries, now have Medicare Advantage plans, Part C, which we'll talk about, and 50% have original Medicare. Well, they'll have A and B and need to get a Part D. If you go back 15, 20 years ago, it was like 20% of the people had Medicare Advantage plans. But as time goes on, more and more people turn to Medicare Advantage plans. And we'll see why as we go forward. It's less expensive in most cases. But everybody needs, the federal government says they expect everybody to have some form of prescription drug coverage, first offered in 2006. Sometimes people will ask, well, is it a law that I have to have it? No, you don't have to have it. But if you don't sign up for it when you're eligible for it and you don't have some other kind of credible prescription coverage, then you end up with a penalty on that too as time goes forward. The longer you wait, the more penalty you'll pay when you sign up for a Part D too late. If you have credible coverage through some other situation, though, you can avoid buying Part D when you first go on Medicare. Well, where do you get this coverage? Where do you get this creditable coverage? Your own employer, if they continue to provide it. It could be a retiree plan if they continue to provide prescription drug coverage. It's considered credible. It can be a spouse's employer that provides it for you. And these companies are required to send something out once a year that says that their coverage is creditable and it serves the same as Part D, and you won't have a penalty if you don't sign up for Part D. But Part D gives beneficiaries the option to enroll in a prescription drug plan that will help with the cost of a broad range of prescription drugs. If you have prescription coverage from an employer, a retiree group plan, federal employee health plan, TRICARE for life, COBRA, etc., that is deemed creditable, then you don't have to have Part D. And if that coverage ends, you have 63 days to sign up for Part D without incurring a penalty. COBRA. Most people have an idea what COBRA is. That's insurance that if you lose your job, lose your insurance through an employer, get fired, whatever, you have a right through the government to buy COBRA, which will continue the insurance that you had with that employer for up to 36 months, I think. You pay a very high premium for it, more than you did as an employer. I do want to point out that COBRA is creditable in most cases for Part D insurance. But it is not creditable for signing up for Part B. So you need to remember that. If you have COBRA, once you lose that retiree insurance, you go on COBRA, you still only have 8 months to sign up for Part B without a premium. COBRA will not cover you for that, but it will cover you for Part D to avoid the penalty. Well, in Texas in 2024, we do know these numbers now, there are 22, I think, Part D standalone plans available. The premiums for 2024, believe it or not, range from 50 cents to $108. Some states, that plan is 50 cents here is nothing, zero. That's a WellCare plan. You may wonder why. Well, it probably, if you look at the coverage, it may not be as good as far as complicated prescription, but it is there, and it costs 50 cents. Premiums run all the way up to $108.30. There are deductibles on these plans that next year will run from $0 to $545, meaning you pay the full cost of the drug on certain drugs, normally high-tiered drugs, for until you reach $545. Most plans, your preferred drugs, not the real expensive ones, but the ones that are cheap and generic, it doesn't apply to the deductible. But normally when you start getting into prescription drugs, it's a deductible. So if you have nothing but the generics or a lot of generics, you're not going to be subject to this deductible plan right off the bat. With your expensive prescription drugs, you will be. Now, in 2024, also, there's a coverage gap that begins after you and your drug plan each have spent $5,030 on covered drugs. So if you've got a prescription to pay and it's $25 on a drug and your insurance plan pays another $75, then that's $100 that goes toward that coverage gap, as we call it. And once you reach that, then you're going to go into what they call a coverage gap, and you'll pay more. This amount changes each year. You'll pay more for prescriptions when you're in the coverage gap. I put donut hole there because a lot of people still call it a donut hole. Sometimes you'll even see the insurance calling it that. It really is no longer a donut hole, because when we had what was called a donut hole, you paid 100% of the cost of the drug when you went into that coverage gap. Now you pay 25%, which is originally what was intended when they signed the prescription drug plan into place back in 2006. In 2024, the so-called burden of the coverage gap is still moderate. Like I say, you'll now pay no more than 25% of the total cost of the drugs, but you won't pay less than what is the full extra help prices for those with lower income that qualify for extra help, which we'll talk about later. Also, low-income beneficiaries, as I say, who qualify for extra help and paying Part D costs will not enter this so-called coverage gap. They'll keep the same low prices all year long, regardless of a coverage gap. I point out at the bottom, once again, IRMA. Part D prescription drug plans are also subject to IRMA. If you fall into those income categories we talked about, $97,000 or more, $194,000 or more for married couples filing jointly, you'll pay an additional premium for the Part D plan from $1,220 to $76.40. So it sounds kind of odd, but if somebody did have an income over $500,000 and signed up for the 50-cent plan, they'd pay another $76.40 a month on top of that 50 cents. One way to think of the math. Well, there are some Part D changes coming. Some this year. Part D plans. One thing that's happened this year is the fact that insulin, which used to be very, very expensive, some plans with insulin, you could end up paying a couple $100 a month for your insulin for diabetes. Now it's limited, where any company cannot charge, no insurance plan is going to charge you more than 35% for 1 month's supply of insulin, as long as that insulin is on their list of drugs. Also, there's some free vaccines now covered by Part D that weren't before. Also, the drug companies have entered into an agreement with the government that they'll pay rebates if they raise prices on the prescriptions faster than general inflation is. The Part D premium in 2024 is going to be capped at 6% a year. Also, there's a co-insurance of 5% that's been in place. Once you go through the deductible stage on a prescription drug plan, then you go in the general part where you pay small copays. Then you fall into that coverage gap or donut hole that we mentioned before. When you get up to a certain amount of money and fall out of that donut hole, you've always had to pay 5%. Doesn't apply to a lot of people, but a lot of people fall in that. That goes away in 2024. It will no longer be there. Also, there's something called out-of-pocket expenses. We mentioned on the previous slide, in fact, I'll show it again. The second point there, $5,030, you go into a coverage gap when the total amount that you and your drug company have spent reach $5,030. What normally happens is, in the past and this year, when you reach $8,000 of out-of-pocket expenses, what you paid out of your pocket for copays and drugs and so forth, when that reaches $8,000, then you went into a catastrophic level where you pay 5%. Next year, that 5% goes away. And instead of $8,000, next year, there's a maximum of $2,000 that you pay out of your pocket for drugs. So up until this year, some people could have paid $15,000, $20,000 out of their pockets with a prescription drug plan. This year, it taps out at $8,000. Next year, it taps out at $2,000. That's the Inflation Reduction Act that was passed last year. And of course, in 2026-29, there's going to be a negotiation between Medicare and the prescription drug plans, or between the drug companies on certain high-cost drugs to try to get lower prices. Some changes are coming. Well, what about your Medicare options? Like we say, you can do original Medicare where you have Parts A and Part B. You can add a Part D prescription drug plan, and you can also get a supplemental plan, or what we call a Medigap plan, to pick up the co-payments and the deductibles that Part A and B don't pay. But you also have a choice to go to what's called Part C, which is a Medicare Advantage plan. These are the ones, like we said, that are offered by private companies. They're still monitored by Medicare. They have to meet certain guidelines, but they can provide you coverage for your A and for your B, and also Part D is normally going to be rolled into it as well. They have different things. They're all different. In other words, rather than having a $1,600 deductible when you go into the hospital, they may have $100 a day for the first 5 days, or $150 a day for the first 7 days. And then it changes. They're going to have a certain amount that you may pay every time you go to a doctor. They're going to be different. Some of them have lower out-of-pocket costs. Some of them provide extra benefits. But let's look at them a little closer. Part C, Medicare Advantage plans. It's an alternative to original Medicare. It's offered and administered by the federal government. Like I say, it's offered by private insurance companies. They have to be approved by Medicare. They provide and administer benefits for their members. They have the same coverages and the same services as Part A and B. And in most cases, the prescription drugs are going to be covered, but they cost different amounts and they'll pay different amounts. There are more predictable co-payments and deductible amounts. And oftentimes they'll offer additional coverage for dental and vision and hearing. And of course, as we know, particularly if you think of the year before last with all the advertisements on TV, the Joe Namath and the Jimmy J.J. Walker and William Shatner, they made it sound almost as if you're losing something if you don't get a Part C and you're missing out. They were made to tone down because it was kind of misleading. Medicare Advantage plans are fine, but original Medicare has its advantages as well, even though it's not an Advantage plan. The additional coverages that are offered, as you know, because you hear about it, some of them, even for certain people, they'll offer home-delivered food. And some of them will even offer a rebate, or they put money back in your account for your Part B premium that you had to pay. But you get what you pay for. So normally you'll find a little less coverage with those things. And the idea of delivering meals to you, it doesn't mean anybody just because you have the plan. It's somebody that needs it. You have to prove that you need it. You normally have to be, housebound or something. As far as Medicare Advantage plans, and keep in mind that you do have to have Parts A and B. even with a Medicare Advantage plan. You may get a Medicare Advantage plan that has no additional premium, but you still have to have Part A and Part B. If you have premium-free Part A, then you got to pay a Part B premium. If you don't have premium-free Part A and you want a Medicare Advantage plan, you're going to have to pay for Part A and Part B. This gives you an idea for 2024 what's being offered in the Alamo area. Bexar County, you'll see, has 31 HMOs, which are health maintenance organizations, and 26 PPOs. And then they have 38 special needs plans, and you'll see the various things that happen in other counties. HMOs, health maintenance organizations, normally are restrictive in that you have to stay within a network of doctors. You get a plan with United Healthcare, you get a plan with Cigna, there are going to be certain doctors that will accept that plan. You cannot go out of network or you'll pay a full cost for whatever you get going to another doctor. Specialists are going to be listed as belonging to that plan as well. PPOs or preferred providers organizations, normally you're still going to have a lower cost when you stay in network, but you can go out of network, but you have to pay more, maybe a higher copay, maybe 40% of the total cost or what have you. There are special needs plans in all of our counties. Special needs plans are ones that are specially made for people that have certain chronic diseases, diabetes, heart problems, or there are also some that are made especially for people that are in nursing homes. You'll see that when you look at Bexar County and some of the other counties, Como, Kendall, Medina, they offer a lot of HMOs, but then you also find counties like Frio and like Karnes and like Kerr and McMullen where they don't offer very many HMOs because there's not enough doctors in those counties to really make it worthwhile for a network to go there or for an HMO to get in there. So there you're more likely to turn to a PPO. And what we do find is in those counties other than Bexar, particularly the low HMO counties, you're going to find a lot higher proportion of people in those counties that have original Medicare and a Medigap plan. With few exceptions, HMOs in the Alamo area have no premium, but you still have to pay the Part B premium. I want to emphasize that. And some PPOs have an additional premium. Some of them don't. It may range from $16 to $238. You get a PPO with a $238 premium, which I think is a Blue Cross plan that's available in this county. It's going to be just like having regular Medicare and a supplement. I mean, it's going to be very inclusive. Well, what about comparing it, original Medicare versus Medicare Advantage? Some people say, I want to go with the Medicare Advantage. My friend has one, and I know it's less expensive. If you're healthy, it's good. And if you're not healthy, it may still be good. But there are differences. If you look at the comparison, with original Medicare, you have a Part A and a Part B deductibles, and then you're responsible for 20% of the Part B covered services if you don't have a Medicare supplement. With a Medicare Advantage plan, you may be in a plan where the premium and the copay, you have premium, you'll have a copay for in-network services and a larger copay for out-network services if allowed. You still have to pay the Part B premium. You may have a premium to pay for the Medicare Advantage plan, you may not. Well, what about these copays? Well, with original Medicare, you can buy a Medigap or a Medicare supplement, like we talked about, that can pick up those 20% cost in some of the deductibles and copays. If you have a Medicare Advantage plan, you cannot purchase a Medigap. It's illegal. It's illegal for somebody to try to sell you one if you have a Medicare Advantage plan. Under original Medicare, you can see any provider in the country, in any facility in the country, in the United States that accepts Medicare and will accept you. Any doctor that accepts it. That goes for primary care physicians and for specialists. With a Medicare Advantage, typically with most of them, you can only see in-network providers and often only in your service area. You travel to other parts of the country, that plan may not do you any good. Sometimes with very significant emergencies, it may. Referrals. With original Medicare, you pick your primary doctor, you don't like him, you go to someplace else. You don't have to worry about a network. Also, you do not need referrals. Your primary doctor is normally going to recommend if you need a specialist, and he may recommend who you go to, but you can go to anyone you want to go to as long as they accept Medicare. Medicare Advantage plan, typically you do need referrals to see specialists, and you often need prior authorization from the company. Drug coverage. You must sign up for a standalone Part D drug plan or have some kind of coverage to avoid penalties if you have original Medicare. With a Medicare Advantage plan, most of them do provide drug coverage, and I will admit that in many cases the drug coverage provided under Medicare Advantage plan is better than some of the Part D plans. But you limit your flexibility because with a Part D plan, you can change Part D plans every year if you want to during open enrollment. With a Medicare Advantage plan, you cannot change your prescription coverage unless you change the entire Medicare Advantage plan because it's inclusive. One of the things to think about in terms of cost, and this is Medicare Advantage plans, some of them are being very good, but keep in mind the way they get paid is that Medicare will provide the insurance company that provides a Medicare Advantage plan with so much money, maybe $1,500, $1,200, I don't know, so much a month for every beneficiary they sign up for that particular Medicare Advantage plan in the district. So there's still, some of them are very good, but you can think, yeah, they may be just a little more likely to deny a certain type of referral to a certain doctor if they think that unless it's absolutely necessary. You don't have that problem with the original Medicare. So there's pluses and minuses on both sides. Which way to go is up to you. The other benefits, like we said, with original Medicare, doesn't offer vision, hearing, or dental services, although some Medigap policies now for an additional premium, you can get a Plan G or get a Plan N, and you can get some coverage for those things, even maybe a situation where you can go to a health club, a gym, whatever. Some of the Medicare supplements will do that. With a Medicare Advantage plan, they may offer vision coverage, hearing coverage, dental, and other types of services like we know. You hear the advertisements on TV all the time. Out-of-pocket limit, there is no out-of-pocket limit with original Medicare. If you don't have a supplement, you could pay hundreds of thousands of dollars a year if you ended up in the hospital with lots of operations. But you get a Medicare supplement, and you can pay nothing out of your pocket other than that Part B deductible. Whereas with the Medicare Advantage plan, you do have out-of-pocket limits, so it's going to limit it. But it's likely to run anywhere from $2,900 to $13,000, I think, in Bexar County right now, which means if it's a $5,000 out-of-pocket limit, you'll pay your copays. You may pay for things to go to the hospital. You get up into October, you paid $5,000 out of your pocket, then you're covered 100% for the rest of the year. But starting January 1st, it starts all over again where you've got those deductibles. So again, it's an offset. An example of costs, and this is simply an example, but if you qualify for a standard premium, you pay a Part B premium of $164.90 under original Medicare. A Medigap, the price is normally going to be higher the older you get. It's normally a little cheaper with some companies with a female than it is for a male at each age level. But as an example, with some company, you're 65, you may pay $120 for a certain plan. You may pay more, you may pay less, depending on who you get it with. You get a Part D plan, as an example, I'm saying, let's say it's $25. So your monthly cost is $310 a month. Whereas if you go with Medicare Advantage plan, you still got to pay that Part B premium, but you pay nothing for many of the Medicare Advantage plans. You may pay something. Part D is normally included, a prescription drug coverage, so it may cost you $165 a month. So which way do you want to go? It depends. If you get very, very sick and you have all kinds of expenses, it might be advantageous to have the original Medicare. But if you don't and you stay healthy, the Medicare Advantage plan might be good. Open enrollment, I mentioned at the bottom. And this is one thing I want to point out. Open enrollment is from October 15th to December 7th each year. A lot of people who are getting ready for Medicare think, open enrollment, I'm going to turn 65 next year, or I did this month in August, which it might be a little late. They're thinking, I get to enroll in Medicare. Open enrollment has nothing to do with originally enrolling in Medicare. Open enrollment applies to Part C and Part D. It is a time where you can change Medicare Advantage plans between October 15th and December 7th, change to a new one to become effective January 1st, or you can change prescription drug plans to become effective January 1st. You also have an additional open period from January 1st to March 31st now, where if you have a Medicare Advantage plan, you can drop it in order to get another Medicare Advantage plan, or you can drop it to go back to original Medicare and get a Part D. However, you cannot drop the Medicare Advantage plan and sign up for or go back to original Medicare plan. So that's one thing to think about. Well, what about help with Medicare costs? Several things. One is called Extra Help, which is low-income subsidy, which is provided by Medicare, which is a program that will help you qualify and pay for your prescription drug costs. and all of the Part D premium if applicable, and you can avoid the donut hole, or the covered gap as we call it. You may qualify for extra help in 2023 if your income and your resources are below certain limits. If you're a single person and your income is less than $1,843 a month, and your resources is less than $16,600, and this doesn't include the house that you live in, it doesn't include a couple vehicles, it doesn't include money you may have set aside for burial insurance, things like that. But if you have stocks and bonds and CDs and so forth, that's going to count. If you're a married person living with a spouse and no other dependents, then you can have income of $2,485, resources less than $33,240. This year and every year before, this extra help that is provided is sort of done on a split basis. $1,843 and $2,485 for two people is 150% of poverty level, which means you can have up to 150% of the federal poverty level and qualify for this. However, people that got what's called full extra help had to be at 135% or less. If you were between 135% and 150%, it broke down so that you only got 75% help if you were at 140%, 50% help at 145%, and 100% help at 150%. Starting in 2024, that differentiation goes away. Anybody below 150% of the poverty level, like the 1843 this year, although it's going to go up for inflation next year, get full extra help. They pick the plans that may have no premium for people with extra help. And there's only 2 of them next year, but they pay nothing and they don't have to worry about that split help. They get the deductibles all gone and they pay the lowest copay possible. There are some plans, Part D plans, where you don't get full extra help regardless. It's just like next year, $28.40 reduction off the premium. But there are some where you get everything, but at least it's going to change yesterday and be better for everybody that's got low income below 150%. Also, there's a Medicare Savings Program. If you have limited income and resources, you may qualify for this program where the state will help you pay some or all your Medicare costs. Some programs may pay only Part A or Part B premiums. Others may pay premiums and deductibles, and co-insurance may pay all of them. You can qualify for the Medicare Savings Program if you have income and resources below these limits in 2023. Single person, $1,660, and married and living together below $2,239. So you can see these are slightly different than the extra help. You can not qualify for this and still qualify for extra help on the drug plan, perhaps. But anything and all of these things are going to change, and they're going to change next year. The numbers are going to be different. We have a benefits enrollment center here at ACOG, and so you can call the toll-free number that's shown, and you can apply, come in, make an appointment, come in and apply for the Medicare Savings Program, low-income subsidy, SNAP, several other things, Medicaid. Sometimes this can be done over the phone, but it's also there if you need to come in. And once again, we have the numbers up here that if you need help, questions on things I've asked, or you need to work with a benefits counselor, you can call the local number 477-3275, or you can call the toll-free number 866-231-4922. Talk to somebody in the Alamo Service Connection. They can arrange to have a benefits counselor call you back at some point. And when they call you and contact you, they'll try to answer your questions. And if it's absolutely necessary to come in, then they can make arrangements for you to do that. And we do have people that go out into the counties. Thank you very much.